Chapter 45, Nutrition. As you go through this chapter, consider the foods that you ate yesterday. Something that's vital in the United States is food security. So food security is necessary for all members of a household. This means that every individual in the house has access to sufficient, safe, and nutritious food to maintain a healthy lifestyle. Think about some of the nutritional needs for this patient. Basal metabolic rate, or BMR. This is the energy that's needed to maintain life-sustaining activities while an individual is at rest. These activities include breathing, circulation, heart rate, and temperature. The nutrients are the necessary elements for the normal function of the body's processes. Carbohydrates, composed of carbon, hydrogen, and oxygen, are the main source of energy for one's body. Proteins provide a source of energy. They are needed for growth, maintenance, and repair of body tissues. Fats are the most calorie-dense nutrient that we ingest. Water is crucial because cellular function depends on fluid movement, and water makes up 60 to 70% of the total body weight. Vitamins, these are organic substances that are available in some of the foods that are eaten. These vitamins are necessary to sustain normal metabolism. There are fat-soluble vitamins, A, D, E, and K. And there are water-soluble vitamins. These are vitamin C and the vitamin B complex. Minerals are inorganic elements that are essential to the body. These elements are catalysts in biochemical reactions. These are classified as macro minerals or micro minerals. Each part of the GI system has an important digestive or absorptive function. Enzymes, these are protein-like substances. These act as catalysts to speed up chemical reactions. These are an essential part of the chemistry of digestion. The small intestine that is lined with villi, which are finger-like projections, this is the primary absorption site for nutrients. Metabolism actually refers to all of the biochemical reactions within the cells of an individual's body. Metabolic processes are either anabolic, which is building, or catabolic, which is breaking down. The recommended daily allowance, or RDA, this represents the average needs of 98% of the population. It's not the exact needs of every individual. So there are dietary guidelines for Americans for the general population to adopt a healthful eating pattern at an appropriate caloric level, eating nutrient-dense foods, maintaining a healthy body weight, the encouragement of physical activity to decrease sedentary activities, eating fruits, vegetables, and whole grain products, seafoods, and fat-free or low milk products, eating a variety of proteins, thinking about lean meats, seafood, and poultry, eggs, legumes, nuts, seeds, as well as soy. Limiting the saturated fats and trans fats, limiting added sugars or sweeteners, consuming less than 2,300 milligrams of sodium daily, to choose and prepare foods with little salt and eating potassium-rich foods, limiting alcohol intake to moderate use, which is considered as 1 daily drink for a woman and 2 daily drinks for a man. So considering the case study and the progress of the patient so far, has your mind taken you to critically think about the patient's feedings and what kind of feedings the patient will get? You should be on the thought process of the patient getting enteral feedings and be thinking about ways that the nurse will help the patient in achieving progress back to oral feedings. A 22-year-old new mother is breastfeeding. You ask her if she is taking the correct quantities of nutrients. Which statement reflects that she understands the dietary guidelines? I am not concerned with what I am eating. I'm taking vitamin doses based on TV. I am taking a daily MBI. I am making eating choices according to the recommended daily allowances. And so obviously knowing that she needs correct quantities of nutrients, the answer is D, that she is making choices according to recommended daily dietary allowances. Environmental factors beyond the control of individuals contribute to the development of obesity. Obesity is at an epidemic proportion in the United States. Nursing understands that environmental factors can limit the person's likelihood of healthy eating and participation in exercise or other activities that relate to healthy living. Rapid growth and high protein, vitamin, mineral, and energy requirements mark the developmental stage of infancy. An infant routinely will double birth weight at 4 to 5 months and triple it at 1 year. Infants should never have regular cow's milk during the first year of their life. During the adolescent period, the physiologic age is a better guide to nutritional needs than chronologic age. Energy needs increase to meet greater metabolic demands of growth. The daily requirement of protein also will increase. Calcium is essential for rapid bone growth of the adolescent, and girls need continuous source of iron to replace iron lost when menstruating. Boys also need adequate iron for muscle development. There is a reduction in nutrient demands as the growth period ends. Mature adults need nutrients for energy, maintenance, and repair. Energy needs usually will decline throughout the years. Adults 65 years and older have a decreased need for energy because their metabolic rate slows with age. Yet, the vitamin and mineral requirements remain unchanged for the individual from middle adulthood till the present. So what type of effects would dysphagia have on nutrition and intake for the patient? There are implications for patient-centered care. As nurses, we know we need to ask the patient or the caregivers to identify the meaning that certain foods have for the patient. Lactose and other food intolerance are unique to some cultures and require diet adaptation to meet nutrient, mineral, and vitamin daily intake requirements. When patients use hot and cold foods as part of cultural health practices, dietary modifications are needed. Hot foods include rice, grain cereals, alcohol, beef, lamb, chili peppers, chocolate, cheese, temperature zone fruits, eggs, peas, goat milk, corn husk, oils, onions, pork, radishes, and tamales. The cold foods are considered beans, citrus fruits, tropical fruits, dairy products, most vegetables, honey, raisins, chicken, fish, and goat. The nurse understands that they need to ask the patient or the caregiver if there are any specific conditions like menstruation, cancer, pneumonia, earache, paralysis, headache, that are cold illnesses and require hot foods. Some conditions like pregnancy, fever, infections, rashes, liver problems, or sore throat, these are hot conditions and these require cold foods. This is information that is vital for nutritional assessment for the patient. For critical thinking, the nurse understands they need to have a basic and general knowledge of the necessary nutrients needed by every individual to sustain life. The nurse also understands that they need to ask the patient for preferences and consider their culture and food likes and dislikes before putting all the information together and determining a plan of care with the patient. Patients that are malnourished on admission, they're at a greater risk for significant complications. Think about arrhythmias, skin breakdown, sepsis. So as nurses, we always ask patients about food preferences, values that they have regarding nutrition, and expectations from the nutritional therapy that they will receive. There are nutrition screening tools that gather data on the current condition of the patient and may include objective measures, height and weight, weight changes, primary diagnosis, and if there's any other comorbidities present. Rapid weight gain or loss is important because it usually reflects a fluid shift. 1 pint or 500 milliliters of fluid will equal 1 pound. There are some common laboratory values that are used to study nutritional status, and that will include when we take blood samples to gather information related to plasma proteins like albumin level, transferrin level, prealbumin, total iron binding capacity, hemoglobin. Dysphagia for us is an understanding that someone is having difficulty with swallowing. So as nurses, we know that we need to understand warning signs of dysphagia. These warning signs would include coughing during eating, change in voice tone or quality after swallowing, abnormal movements of the oral cavity, whether it's the mouth, tongue, or lips, maybe slow, weak, imprecise, or uncoordinated speech. Always nurses need to consider the gag reflex. We also want to make sure that we are looking at if they have any incomplete oral clearance or pocketing of nutrients, regurgitation issues, delayed or absent trigger of swallowing, inability to speak consistently. These are all various signs that should alert the nurse to dysphagia. The student nurse assessed the patient for the risk of aspiration, evaluated the swallowing ability, monitored the patient's respiratory status, and assessed the nutritional status of the patient. What type of diagnosis would you expect for this patient? A nutritional problem occurs when the overall intake is significantly decreased or increased, or when one or more of needed nutrients are not ingested, completely digested, or completely absorbed. Some expected outcomes for the goals that are listed. The patient's weight at discharge will be within 2 pounds of the admission weight. The patient will not exhibit signs of aspiration prior to discharge. The patient's albumin and prealbumin levels will remain normal before discharge. The patient will progress to an oral diet before discharge to a restorative care facility. Planning to maintain the patient's optimal nutritional status requires a higher level of care than simply correcting nutritional problems. Often, there is a need for patients to make long-term changes for their nutrition to improve. Diet therapies are chosen on the basis of the patient's overall health status, the ability to eat and digest normally, and long-term nutritional needs. The focus of health promotion is to educate patients and family caregivers about balanced nutrition and to help them obtain resources to eat high-quality meals. Meal planning considers the family's budget and different preferences of family members. Foods are chosen on the basis of the diet prescription and recommended food groups. Remember that food safety is an important public health issue. Foodborne bacteria can occur from improper food cleaning, preparation, or poor hygiene practices. It is important to assess the patient's nutritional status continuously and to adopt interventions that will promote normal intake, digestion, and metabolism of the nutrients. Patients who are listed as NPO and receive only standard IV fluids for more than 5 to 7 days are at a very high nutritional risk. There are various therapeutic diets, and their progression is going to be listed as stated. Clear liquids is number 1. This is clear fat-free broth, bouillon, coffee, tea, carbonated beverages, clear fruit juices, gelatin, fruit ices, popsicles. It has to be able to be seen through if it's in a clear cup. Full liquids. These are clear liquids with the addition of smooth textured dairy products like ice cream, strained or blended cream soups, custards, cooked cereals, vegetable juice, all fruit juices, puddings, and frozen yogurt. With dysphagia, the patient will often need thickened liquids or pureed diet. This is the clear and full liquid with the addition of scrambled eggs, pureed meats, vegetables and fruits, mashed potatoes and gravies. The mechanical soft diet is clear and full liquid and pureed with addition of cream soups, ground or finely diced meats, flaked fish, cottage cheese, rice, pancakes, some light breads, cooked vegetables, bananas, peanut butter. A soft or low residue diet is the addition of low fiber. These are easily digestible foods like pastas, casseroles, moist tender meats, and cooked vegetables and fruits, as well as desserts and cakes or cookies without nuts or coconut. A high fiber diet, this is the addition of fresh uncooked fruits, steamed vegetables, bran, oatmeal, and dried fruits. Low sodium diets, this can be 4 grams, it can be 2 grams, 1 gram, or 500 milligram sodium diet. It depends on the restrictions placed by the prescribing physician. A low cholesterol diet is stated as being 300 milligrams of cholesterol per day. It goes along with the American Heart Association guidelines for reducing serum lipids. The diabetic diet. This focuses on total energy, nutrient, and food distribution. This includes a balanced intake of carbohydrates, fats, and proteins with various caloric recommendations to accommodate the patient's metabolic demands. The gluten-free diet. This eliminates wheat products, oats, rye, barley, and their derivatives. A regular diet has no restrictions with it unless they are specified. So as a nurse, we know that we need to provide an environment that promotes nutritional intake. This includes keeping the patient's environment free of odors, providing oral hygiene as necessary to help remove unpleasant taste or improve the taste mechanism, and maintaining patient comfort. Oftentimes, offering smaller, more frequent meals may be very helpful. Enteral feedings are the preferred method of meeting nutritional needs if a patient is unable to swallow or take in nutrients orally, but they have a functioning gastrointestinal tract. Patients with enteral feedings will receive a formula through a nasogastric, a jejunal, or a gastric tube. There are various formulas. So the polymeric formula includes milk-based blenderized foods that's prepared by the hospital staff or in a patient's home. For this type of formula to be effective, the patient's GI tract has to be able to absorb whole nutrients. The modular formula, this is a single macronutrient, whether it's protein, glucose, lipids, and this is not nutritionally complete. This can be added, this formula, to other foods to meet the patient's individual nutritional necessities. The elemental formula, this contains pre-digested nutrients that are easier for the partially dysfunctional GI tract to absorb. The specialty formula, this is designed to meet nutritional needs depending on certain illnesses like liver failure or pulmonary disease. Routinely, a tube feeding will begin at full strength using a slow rate. The rate will be increased every 8 to 10 hours per the provider's order if there are no signs of intolerance. So signs of intolerance might be high gastric residuals, nausea, cramping, vomiting, or diarrhea. A very serious complication that is associated with enteral feedings is aspiration of formula into the tracheobronchial tree. Aspiration of enteral formula into the lungs irritates the bronchial mucosa. This results in decreased blood supply to affected pulmonary tissue. This will lead to necrotizing infection, pneumonia, and potential abscess formation. Enteral tube feedings are used with patients who are unable to ingest food, but maintain the ability to digest and absorb necessary nutrients. Feeding tubes are inserted through the nose, which is nasogastric or nasointestinal, surgically, which is a gastrostomy or a jejunostomy, or endoscopically, which is known as a PERC tube or a Page tube. So that is a percutaneous endoscopic gastrostomy or a jejunostomy. The nasogastric or nasojejunal feeding tubes can be used if the patient is expected to need enteral therapy for less than 4 weeks. Surgically or endoscopically placed tubes are preferred for long-term feeding, which is more than 6 weeks. This helps reduce the discomfort of nasal tube and provide a more secure and reliable access to give the patient nutrients. The most accurate method for the verification of any tube placement is an X-ray film. At the bedside, the nurse can test the pH of the secretions that are withdrawn from the feeding tube to confirm the tube location in an ongoing basis. The nurse can also take measurements of the tube from the tip of the nares to the end of the tube. This length of tubing should also never change and remain constant. So looking at these interventions, there's various rationale for these interventions. The enteral tube feeding will allow for safe provision of nutrients while swallowing is being rehabilitated. Tube feeding is initiated at a slow rate of infusion and is increased slowly to allow for the maximum tolerance. Abdominal pain, large volume of gastric residuals, and diarrhea are signs of feeding intolerance and need to be evaluated immediately. The head of bed elevated a minimum of 30 to 40 degrees. This decreases the risk for aspiration, and this is always a must when providing tube feedings to the patient. Gastric residual volume will help indicate whether gastric emptying is delayed. Delayed gastric emptying also increases the risk for aspiration. Regularly provided speech therapy can help the patient regaining the ability to swallow foods and liquids. You receive an order to begin enteral tube feedings. The first step is to place the patient in a prone position, irrigate the tube with normal saline, check to see that the tube is properly placed, introduce a small amount of fluid into the tube before feeding. The answer is D. Introduce a small amount of fluid into the tube before feeding. Parenteral nutrition. This is a form of specialized nutritional support that is provided intravenously. These patients are unable to digest or absorb enteral nutritional benefit. The basic parenteral nutrition formula is a combination of crystalline amino acids, hypertonic dextrose, electrolytes, vitamins, and trace mineral elements. Total parenteral nutrition is administered through a central line access. This type of formula is a 2-in-1 formula, which includes the administration of fat emulsions. This occurs separately from the protein and the dextrose solution. Patients who have short-term nutritional needs receive IV solutions of less than 10% dextrose through a peripheral vein in combination with amino acids and lipids. Total parenteral nutrition is more calorically dense than peripheral solutions. Peripheral solutions are for temporary use. A solution that has greater than 10% dextrose requires a central venous catheter. This is a catheter that is surgically implanted into a high-flow central vein, like the superior vena cava, and this is introduced under sterile conditions. When providing tube feedings through a central venous line, an infusion pump should be used to deliver a constant rate. The initial rate will deliver no more than 50% of the estimated needs for the first 24 to 48 hours, and then gradually increase until the patient's complete nutritional needs are supplied. One common factor is that blood glucose levels need to be monitored every 6 hours when providing parenteral or total parenteral nutrition. The nurse is assessing for hyperglycemia. Restorative care includes immediate post-surgical care and routine medical care, and this therefore will include patients in the hospital and at home. Medical nutritional therapy is the use of specific therapies to help treat illness, injuries, or condition. It is necessary to help the body metabolize some nutrients, correct nutritional deficiencies related to a disease process, and eliminate foods that can exacerbate disease symptoms. Malignant cancerous cells compete with normal cells for nutrients, increasing the patient's metabolic needs. Most cancer treatments cause nutritional issues. Patients with cancer often experience anorexia, nausea, vomiting, and taste-related issues. The goal of nutritional therapy is to meet the increased metabolic needs of the patient. Malnutrition in cancer is associated with increased morbidity and mortality. Enhanced nutritional status will often improve the patient's quality of life. What type of outcomes would the student set for the teaching sessions? So at the end of the teaching session, the patient family will be able to state measures to reduce foodborne illnesses. Some of these measures will include washing hands, the preparation of surfaces and utensils, as well as cooking meats and poultries to the proper temperature, the washing of fruits and vegetables, refrigerating foods within 2 hours of cooking, cleaning the inside of the refrigerator and microwave regularly with bleach or soap. Some of the nursing interventions that are taken to verify achievement of an outcome could include asking the patient if she's experiencing any gastrointestinal discomfort, weighing the patient weekly, monitoring the patient's lab values, and asking therapy about the patient's swallowing rehabilitation. Nutritional therapy does not always produce instantaneous and rapid results. Changes in the patient's condition will indicate a need to change the nutritional plan of care. Think about what information should be included in the nursing students' documentation. So when thinking about safety guidelines, you want to make sure that we use the rates of medication, because these types of nutrition are going to be prescribed by the physician. You always want to make sure, if it's a tube feeding, that the patient's head of the bed is elevated between 30 to 45 degrees. Obviously, we are using aseptic technique whenever we are delivering any type of enteral tube feeding. A food infusion or a nutritional infusion pump should be used for continuous enteral feedings and parenteral nutrition to ensure that the patient receives the adequate amount of nutritional value. No food coloring should ever be added to any type of enteral nutrition.